This is the approach to hemoptysis, that is, coughing up blood out of the lung. You'll see why that matters towards the end. The advanced organizer is battle camp. Now, I know that battle camps don't have anything to do with hemoptysis, except maybe spreading TB. And I'll be honest that I borrowed this from one of the people I trained with and then tacked on some additional diagnoses to make it more thorough. So it's not the best advanced organizer, but it is a way to keep track of all the causes of hemoptysis. B is bronchitis, the most common cause. You just cough so much, you pop a blood vessel. This goes along with bronchiectasis. With bronchiectasis, you're much more likely to have hemoptysis. A is for aspergillus and autoimmune. T is for TB, a tumor, lung abscess, and E is for embolism. And it does not matter what type of embolism it is, whether it's the DVT, thromboembolism, placental contents, air, or fat from a broken bone. If you have sufficient necrosis of the lung from that embolism, you could end up coughing up blood. C is for cystic fibrosis, which gets into bronchiectasis. But if you cough and pop a blood vessel, you bleed. So if you're suffering from a coagulopathy, that bleeding may occur with less force. A's are the vascular stuff. That is arteriovenous malformations and diffuse alveolar hemorrhage. M is the mitral valve, and this is really to make the mnemonic work. Mitral valve stenosis, much more than regurg, generally presents with pulmonary edema, but you might get pink frothy sputum, which leads you down the hemoptysis tract. So I like to include that on there because A, it makes battle camp work, and it helps remind you that, A, that pink stuff, might think about it in a sort of a hemoptysis sort of way. And then finally, P is pneumonia. And this is a short one, but what I want to also teach you here is make sure you call the right person, right? Because patients are unreliable. And if they say, well, I've got blood coming out of my mouth, you need to make sure that you clarify. It's sort of like being dizzy. Right? That doesn't mean anything to us for clinical reasoning, but it means something specific to the patient. You have to find out, do they mean vertigo or loss of consciousness? Blood per os doesn't necessarily mean hemoptysis, right? You actually have to decide, is this actually hemoptysis? The blood is coming from the lung, or is it really hematemesis? And asking targeted questions can get you there. Specifically, if you're having problems with the lung, you're likely to have associated symptoms that are lung-like, versus if you're having problems with the GI tract, you're probably going to have associated symptoms of the GI tract. For example, if someone has blood coming out of their mouth and it is from the lung, they're likely to complain of their sputum being streaked with blood. They will have a cough, the symptom of the lung, but they won't have nausea and vomiting. That's hemoptysis, call pulm. You're going to start with an X-ray, likely get a CT scan, and pulm may bronch, depending on what they find. Pulm is the one you call, pulm's the one who chooses. In the hematemesis side, if you're coming in with blood from your mouth and it's from the GI tract, it's the opposite. You won't have anything streaked in your sputum, you won't have a cough, and you will have nausea and vomiting. And even better, if it's been going on long enough, you might have dark tarry stools. If that's actually what the patient meant, then you need to call GI or an endoscopy. But you want to make sure that you clarify so you call the right person. That is approach to hemoptysis.